So we're going to start. We are looking at formulation with mimosa. Last week we talked about mimosa in general. That was our plant exploration. So when we talk about mimosa, what we're talking about is Albizia, Albizia julibritsin. And so if you didn't watch that, definitely go back and watch that because that'll kind of cover some of the bases. Hey, you! Some of the basics of this formula. But we're going to look at formulation with the bark today. Because the bark is one, while it's very traditional to use, there's very specific methods of use right now that have more to do with mimosa's use as that, well, as the mood elevating, tree of collective happiness we are talking about. That is a really important job and a big job in the world today to kind of lift up people's happiness. And so it's no surprise that that is the focus for many people of this plant. But I want to introduce one of the other primary uses of it, which can also be really, really beneficial for folks. Hey, and it certainly is one of the primary reasons that I like to use it, and that is use of the bark for support in conditions of pain and inflammation, in trauma, in swelling, and in chronic degenerative conditions of the joints like arthritis, ligament and tendon damage. So we're going to look at that. We're going to look at mimosa bark's use specifically for pain. And this is an area, again, most people are using it for that kind of mood elevating thing. Hey folks, hi Ren. Nice to see you toast too. So we're going to look at that. Most of the information out there lately is on its mood elevating effects. And again, that's lovely. But yeah, so we're going to look at mimosa bark, and we're going to be using it as a tincture. So we're going to be talking about its use as a tincture and blending in with other tinctures. Abahita, oh, it is so good to see you. Yay, welcome back. Yes, you've been missed. And then we're also going to, as we're working with the tinctures with the bark, we're going to have a tea that we serve in the shop. And this is our happy tea blend, is the tea blend that I made for you. We're not going to blend with tea because we're blending with the tinctures today. But this is the mimosa flowers. So the flowers have more of an uplifting quality to them, right? The bark is more kind of grounding. Goji berries, honeybush, orange peel, jaugulan. Jaugulan is a member of the cucumber family, or it's a twining vine that has chemistry very similar to ginseng's. It's really, really weird in its chemistry, but it's got kind of a sweet, almost a sweet seaweed flavor, very pleasant flavor, and then peppermint and cinnamon. So it's a really lovely, delicious tasting tea blend, and it's very happy making. So y'all can drink some of this. Oh, thank you. Could you pass those out? Thank you. Thank you very much. So we're going to drink that while we talk about the other. And there's more tea. And then I'm going to have you formulate. So as I'm talking about this, y'all think about the qualities of the product. So again, we're going to look at formulation. Last week we talked about the plant, and now we're going to look at how we modify and expand upon the qualities of the plant. So we start with a mimosa tincture. So this is a fresh bark and flower tincture. So this was tinctured at 1 to 2, 80%. It's a plant that likes a lot of moisture. It's traditionally used as a tea, so we brought the alcohol down a little bit more, but using it as a fresh plant, 1 to 2. So this is primarily the bark with a little bit of flower, and so we can use it as a base either way, where we're going for the energetics of the flower or the energetics of the bark. Here we're going to move it into bark territory. So mimosa bark, again, when we taste it, and actually let me send around some of the tincture so you can remind yourself of the qualities. I don't think I have a bottle. Oh, I do have a bottle of the tincture. Perfect. So I'm going to pass around the tincture. We had the tea last week. Now we're working with the tincture. But what I want you to kind of pay attention to, along with the sweetness, is that quality. And I think you picked up on it last week. The quality of the dispersing, tingly, kind of moving quality. It has a really lovely blend of this sweet, nourishing effect and this stimulating, moving effect, right? And that stimulating, moving effect we see largely in the bark itself, not the flower. It's a little bit more muted in this tincture, specifically because we do have some of the flower there too. But I figure it's nice to have the flower in the blend if we're making a formula for pain, because pain so often comes with it some, you know, sadness and just a lack of happiness associated with being in pain. So it's nice to have that mood lifting effect as we're also working at specifically addressing the physiological effects and patterns of pain. So we've got the mimosa bark and flower as the base, and that tingling quality, right? That is, what is the name of that quality? Some people call it a taste. It is more accurately called a mouthfeel because it's a change in kind of the activity. Do you remember the name of that? It is acridity. Yes, yes, very good. So that's an acrid taste associated with, like, think kava kava or black pepper, right? Kind of a spiciness that doesn't really linger the way that oleoresin-based heats, right? We've talked about that quite a lot, the way that oleoresins bind to tissues. And this is more of a kind of a tingly quality. And that tingly quality of acridity is a quality that releases spasticity of muscles and moves fluids, it moves energy. So it's very much a quality of movement in the body. So very good for stagnation, very good for areas of the body where there is a lack of movement. And this is something that we see in conditions like trauma. If we have acute trauma or even chronic long-standing trauma like arthritis, when that arthritis is presenting with swelling and fluid accumulation, that is one of the hallmarks of mimosa bark, and one of the reasons you would choose to choose that one as opposed to many of the other plants that we would want to use for trauma, for pain and inflammation. If there is no swelling there, then you might think, maybe I don't, or if there's no like stagnation, maybe I don't need to use it, right? It just depends on the quality of the pain in question. But mimosa bark is going to be moving that stagnation, moving fluids out of the area, and also, again, helping with the emotional qualities. So if we combine mimosa then with other things, we can expand on or direct those qualities to other tissues. So one of the things that I like to combine mimosa with is Solomon seal. Solomon seal is a root. We use it in both Western herbalism. It's also used in Chinese herbalism. Probably many other traditions use it. But it is a sweet root. Solomon seal tincture here. It's planting. That's close enough. No, it isn't. No, it's not at all like Scalanthes. Solomon seal is like astragalus, right? Solomon seal is very sweet and very nourishing, very sweet and nourishing. It's a delicious plant. You can use the root and simmer it as a decoction, and it makes a sweet and nourishing decoction. So when we taste that sweetness, we know that those are, polysaccharides, right? Those are compounds that are holding moisture and moving moisture into the body. So we use Solomon seal where there's a pattern of dryness that's contributing to ligament and tendon weakness, specifically ligaments and tendons. Now it also helps with joints, with synovial fluid in joints, with patterns of dryness in the joints. But it really, really is great where ligaments and tendons have become very dry, brittle, maybe overstretched, weak, because ligaments and tendons are avascular. There's no blood vessels moving into them. There's no flow of fluids going into them, right? It's really hard to get fluids in there. And if you can't get fluids into ligaments and tendons, you can't get nutrients in there. You can't move waste products out. You can't get oxygen. You can't do much if you don't have flow in there. So it's really a challenge when those tissues dry out to get them to increase in their elasticity, increase in their ability to hold that moisture again. Solomon seal is one of the plants traditionally used for this, for very specifically that pattern of dryness and weakness and kind of heat and rigidity. Jim McDonald is an herbalist in Michigan, and he likens it to leather, right? You have leather, sometimes you have supple leather, and it's just beautiful and supple, and it moves, and it's just gorgeous. But if you have leather that's dried out, that has become brittle, it becomes really hard and it can almost crack, and it's very hard, it's not supple, it doesn't move. And that's a very much sort of the qualities of ligaments and tendons, where that kind of quality, if you feel that in there, that's where Solomon seal would come in. So the combination of Solomon seal and mimosa bark can be really nice if we're moving fluids, right? Moving everything through, and then also introducing this fluid, introducing more fluids. This is allowing to get stagnation and fluids out of tissues at the same time as it's increasing the movement of fluids into tissues. So this can be really helpful where there is that particular pattern that might be helpful. Hi, Teresa. Hi, welcome. So there's Solomon seal. Another great tincture to add to this is frankincense. So frankincense we generally think of as an essential oil, right? It's a beloved essential oil and resin used in a lot of different practices, but as a tincture, it is, I think, one of the really effective compounds for reduction of inflammation. Now here, there's a lot of misinformation about frankincense on the interwebs, and so we want to talk about that. And we also want to center issues of sustainability with frankincense, right? It is a plant that we don't have, or a resin from a plant that we don't have an abundance of. But that's one of the reasons why I like to use tinctures. Tincture of frankincense is one of the most respectful ways to use the plant, because we can really make a lot of medicine from a relatively moderate amount of raw material. And it's quite effective. But here's the thing, when we're looking at frankincense, if you look at the literature online, if you look at blogs, if you go on TikTok, they're going to talk about frankincense as a pain-relieving agent using the essential oil. Essential oil of frankincense taken internally and applied topically for reduction of pain and inflammation, and also for support of cancer. And the thing is, the chemical in frankincense that's responsible for that, because frankincense is absolutely really effective as an anti-inflammatory and as an agent to support health in people with cancer. Acknowledging that cancer is a very, very complex and multifactorial disease, and it's really hard to say that one thing is effective for all of them. Nonetheless, frankincense, properly prepared, can be very, very effective for both of them. One of the ways that is not a proper preparation of frankincense for pain and inflammation is in the essential oil. And the reason for that is distillation. We've talked about this numerous times. In distillation, when you are distilling volatile compounds from plants, a lot is left behind. That is the nature of distillation. That's why we distill. And in frankincense, one of the compounds that's left behind, sorry folks online, I'm trying to minimize whiteboard because I still don't have the new thing, but I'm going to write backwards for you, so sorry, but I'm going to minimize it. But there's a compound called boswellic acid, or alpha-ketoboswellic acid, also abbreviated as ACBA. And this is one of the primary compounds in frankincense that is helpful at blocking specific inflammatory pathways. So we've talked often about the different ways that we modify inflammation in the body, right? One of the ways is we strengthen tissues. One of the ways is we modify energetics. And one of the ways is we just block those pathways. This is the way that most medications work for reduction of inflammation, is they just block pathways. The problem is that they often block those pathways indiscriminately, causing a lot of side effects associated with that. Well, boswellic acid is able to block inflammatory pathways without having the negative consequences that we often see with things like NSAID drugs, things like ibuprofen and all of that. So it's a very effective anti-inflammatory compound. Boswellic acid is a very effective anti-inflammatory compound and used quite often for treatment of things like arthritis, but also just generally chronic pain disorders. Really effective, completely ineffective in an essential oil, because there's no boswellic acid in an essential oil. There's no boswellic acid in any products of distillation. However, in a simply made tincture, where we're taking the essential, the resin, hold on, big truck coming by. We're effectively taking the resin and dissolving it into alcohol. We're not even really doing an extraction, right? Whenever we're working with resins, we're just kind of dissolving them into a medium and having that carry it. So the tincture is a tincture of frankincense. Very effective to add into your essential, into a tincture blend for pain and inflammation if you want that specific reduction of inflammation. Taking frankincense as a tincture is weird for many people. Here's a tincture, I'll pass it around. It tastes like incense. It smells like incense. It smells gorgeous. It smells, you can like just, it's sticky, it's resinous.
Wait, is it, you can eat it?
You can eat it, yes. But it just smells so delicious. Because you've dissolved resin in alcohol, and now you're just applying that alcohol to your body. But it is, when you taste it, it'll taste like incense, and it coats your mouth because it is a resin. Isn't that weird?
Yeah.
Yeah, I know.
I had a little too much.
Oh. But now when you breathe out, you're gonna breathe. You're gonna taste like a full moon ritual.
It's bitter, right?
Mm.
It's really bitter.
It's bitter and it's resinous.
Yeah.
And the problem with resins is they bind to stuff, and this is going to bind to the inside of your mouth.
Oh, this is my mouth.
Yeah, and it's not going to go because it's a resin. It's nature. Hey, so you can some hot tea will help to dissolve that, right? Heat melts resins. So yeah, that's frankincense. I like the quality of frankincense in a tincture. And I really love frankincense as a pain relieving agent. I've had to deal with a lot of arthritis and damage to my joints because I'm always injuring my body. And so frankincense is one of the things I really love. But yeah, not everyone does. But doesn't it smell wonderful? Yeah, I really love it. What do you think about the?
I feel like we had it before.
Mm-hmm.
I didn't know.
I probably have introduced it to, yes, at some point. Yeah. I love smelling like frankincense. Okay, so 2 more options for your pain relieving effects. Burdock. Burdock is a really important plant when there is that swelling, right? We were talking initially, mimosa is one of the specifics of use for mimosa is when there's swelling in the joint. And we want to think about when there is swelling around some trauma, around chronic pain and inflammation. That swelling is an accumulation of metabolic waste. There's a lot of old dead cells. There's a lot of stuff in there that is better for the tissues if it's removed. But the fact that there's swelling, the fact that there's inflammation means that there's no flow in there, right? And so burdock is really good at, so the other compounds are kind of pushing flow through there. Burdock is good at engaging the lymphatic system as part of that movement of waste products out of the body. So everything else is just kind of sweeping up all of that, but burdock is going in and saying, yes, let's sweep up all of that, but let's take it out of the body and help to clear it out. So burdock is classically used for accumulation of waste in joints, contributing to pain and inflammation. One of the classic examples of this is gout. In gout, we have uric acid that accumulates in joints. Uric acid is a really large crystal, and so it tends to be more subject to gravity than others, and so it tends to fall down in the body, accumulating in the joints at the lowest part of the body, which is the big toe, is one of the primary ones, and so we often see the effects of gout in big toes, but we'll also see it in extremities, right, in hands, less often in hands and arms, very often in the feet. And so when the gout crystals accumulate in those joints, they can be incredibly painful, just incredibly painful, cause a lot of swelling and inflammation. That uric acid is a metabolic waste product that accumulates in joint tissue. It's just something that happens, and it's not the only one. There's other things. And so one of the classic ways to clear gout out of the body is use of burdock, amongst other compounds. So love burdock. It tastes really good. It's very nourishing to the body. It has many other therapeutic effects, but it has that really gentle alterative effect. Alterative effects. Alteratives are plants that gently but profoundly move waste products out of the body and improve the functioning of those channels of elimination, so that after you've taken that course of whatever you're taking, they are increased in functionality rather than overstimulated and decreased. Hi, eyes open. Good to see you. If internally take burdock tea, will that remove all of the waste? It'll remove much of the waste. All of the waste is kind of a big thing. There's a lot of different waste that the body deals with. But burdock is going to be improving flow of the lymphatic system, and it's really supportive to liver function, and it's really supportive to colon function. So 3 of the primary eliminative channels in the body are being supported by burdock. So it is one of the plants, if you're thinking, I just want one thing to take that's going to be improving elimination of waste, yeah, burdock is going to be the one. Plus, it's just delicious. It's lovely to use. So, in most people, that's going to be a beneficial one. Yeah.
You said liver, colon, and what else?
Lymphatic system. Lymph. Yeah. And then we remember also that the lymph is also an important part of the immune system, and so support of the lymphatic system also has a beneficial effect on the immune system. And then the 5th one, so those are all the ones that I grabbed this morning to talk about pairing and sort of looking at the nuance of changing up those formulas. Good to see you, thanks. Oh, absolutely, thank you for asking. Another thing that you can do in a formula like this is you can add something like Corydalis. So Corydalis is a plant from the Chinese herbal tradition. It is the root of a poppy plant. And so it has kind of poppy-like chemistry, and it is used for chronic pain. It is one of the plants that we love to use. We use quite a lot of it for people who just want something for pain. Yeah, I'm doing all of the, long-term effect. I'm supporting the tissues, and I'm reducing inflammation. I'm clearing waste products. I'm doing all that stuff. But also, I just need to not be in pain right now. There are, how to spell it? Yeah.
So it's more of an immediate
Yeah.
for pain relief?
Yeah.
And how does it work as a
C-O-R. Corydalis. In somewhat the same way as California poppy, it has a specificity for the nerves, for nerve pain specifically, but it just kind of dampens nerve pain and activity, dampens the activity of nociceptors, of pain receptors in the body. The mechanism, not really sure. It isn't the same mechanism as mimosa, right? It's a different way that it is relieving pain, but it's a really reliable one. It can be nauseating if taken in too high an amount, but it is considerably less sedative than California poppy. And that is one of the things, is that a lot of the herbs that are used for pain relief are really effective for pain relief, or moderately, not really effective, but moderately effective for pain relief, but they almost always cause sedation as a side effect of it, which is great for night, not so great during the day. So Corydalis is one of the plants that I like because it has less of a sedating effect and a pretty strong and reliable pain relieving effect. So that might be something you'll want to put into a formula. It's not necessary. A lot of times we just want to support healing of an area, and we don't really need to reduce the pain. one of the things that's important to note about Corydalis and also California poppy, because the alkaloids in both of those are going to be papaverine alkaloids. These are the same alkaloids in the same family as morphine and related poppy-based alkaloids. And so one of the questions that people will ask with California poppy and with Corydalis, because they're both poppies, is will this show up in a drug test? Because poppy seeds will, right? But poppy seeds are from specifically the opium poppy, right? Poppy seeds, the little black seeds in your poppy seeds, are not the seeds of California poppy or Corydalis. There was a herb school recently. I want to say the Dandelion Center in Northern California. I don't know if that's correct. Don't quote me on that. I don't know if it's correct. But it was one of the really great little herb schools around, and they did they wanted to answer the question finally about will California poppy cause someone to fail a drug test, because everyone's been like, don't think so, not really sure, doesn't seem to, but no one was 100% sure. So they got a range of drug tests, pee in a cup tests, and all of the students in the school, they did a really well-designed study of it, and came up with a result that no, California poppy does not cause any positive results in drug tests. And so Corydalis also would not, but that's something, you know, that people might ask, right?
Does it have opium in it?
It doesn't have opium in it. It has papaverine alkaloids that are in the same class of compounds. So think like in flavonoid chemistry, right? There's a whole bunch of flavonoids. In polysaccharide chemistry, there's a whole bunch of polysaccharides. In there's a lot of there's larger families of compounds, and then all the little compounds in there. They're related, but the thing is, alkaloids you can't do that with. That's one of the things about alkaloids, is you cannot make assumptions that about a family of alkaloids the way you can with polysaccharides, right? You know a lot about polysaccharides. If I tell you something's a polysaccharide, automatically you are like organizing information in your brain, saying, I know this and this and this and this. You should. By now you should be able to do that. You can't do that with alkaloids, because they're all over the place. They're everything from strychnine to avenine in milky oat, one of the most nourishing and sweet and wonderful and gentle and safe nourishing alkaloids for support of the nervous system, and a poison that will kill you, and morphine, right? So wide range of things that will do all sorts of different things in the body, so you cannot make assumptions about alkaloids. Even if they're relatively closely related, you can't always make those assumptions. So they're confusing. Sorry about the confusion for alkaloids, but all of that. JLP, hi, oh good. Non-sedative pain relief, yeah, Corydalis is great. Another one that you can try, JLP, is, I don't like it quite as much, but many people do, is Jamaican dogwood or Pisidia. Jamaican dogwood is another plant that is relatively non-sedating and relatively reliable as a pain-relieving agent, and I'll often combine Corydalis and Jamaican dogwood. It can have a little bit more of a nauseating effect if you take too much, right? So the dosage on it. All right, so, of Corydalis is Yan Husao. Oh, I'm so impressed that I knew the pinyin name when you asked me. Don't just automatically ask me for pinyin names and assume I'm going to know them. But Yan, ooh, I don't remember if there's an O there. Yan Husao is the pinyin name. This is the common name in Chinese. Sure. Yeah, so think of formulation then. So your job today is you're going to make a formula. I've got a graduated cylinder here and a 15 milliliter bottle. So you have 5 tinctures here and a 15 milliliter bottle. What would you want to put into a formula for your body when you are experiencing pain and inflammation. If you are dealing with ligament or tendon or muscle joint, muscle pain, think about those energetic qualities of frankincense's ability to reduce inflammation versus Solomon's seal's ability to bring moisture into the body. That's always something that for my body is a big issue. With all pain issues in my body, there's always going to be that dryness component because I've got a 60-year-old body, and that's just what happens with older bodies. So certainly, if you're making a formula for someone else, you want to kind of think about those energetic patterns as well. Any questions about the herbs before we go into formulation? Yeah. Sure, and I've got ginger glyceride here. So you could add ginger glyceride in here. Remember that ginger as a tincture in here would have a stronger warming and stimulating and blood moving effect. You've already got some of that blood moving quality from the mimosa, but it's not as strong as ginger, right? And so that might feel really, really good. The ginger glyceride, glycerin isn't a great solvent for the oleoresins. And so with the ginger glyceride, you'll have some sweetness, you'll have some of that warming, but you won't have the oleoresin extraction that would give it that strongly stimulating effect that we would possibly see in like circulation and in joint pain. You may not want that. You might just want that flavor change. But just so if you wanted to add in some ginger, that would be the difference between the glyceride and the tincture. Yeah, but absolutely, ginger would be a great thing. And that's the thing. We could go so many other ways in formulation, right? Starting with that base formulation, all sorts of things. This is just a short class, so I have to had to limit it in some ways. Jamaican dogwood, low dose to avoid nausea, add to Cordellis. Yeah, there you go, exactly, yes. All right, any other questions? All right, so think of how much you want to, what formula you want to do with your 15 mils of tincture. Do any of you online, while they are getting their formulations down, y'all don't get to formulate, sorry, come to Long Beach and come in here, and then you'll get to play with the tinctures by hand. But otherwise, if you have any questions for me, I'll certainly answer them. Otherwise, I'm going to finish up this class, and then we'll see you next week. I was going to do formulation with the bark this week for pain, and then formulation with the flower next week for mood. But I feel like I've done a lot about mood lately. Of course, there's a lot to be moody about lately. So y'all let me know in the comments if you want to do more mood. You're in Santa Barbara? I was born and raised in Santa Barbara. I'm a 4th generation Santa Barbaran. Yeah, I was born in Cottage Hospital. My dad was born in Cottage Hospital. My grandma was born at home. There wasn't a Cottage Hospital then. But yeah, I'm often in Santa Barbara. My family still lives there. Yeah. Let's see. Yeah, so let me know if you do want me to go into the flower formulation next week, or if you've had maybe a little bit too much of me talking about nervines and all of that. And if not, I'll go into another plant. Bahita says, what plants would be helpful for pain relief of muscle pain specifically, like tight muscles due to trauma, physiological reasons, or this is another topic? No, that's a great question to ask for that. So with muscle pain specifically, we want to use antispasmodics when there's When there's muscle pain, I know you like all of the classes, but I like to get some direction. Otherwise, yeah, I'll just do whatever I want to do. But if you have any specifics, I'll do it. Otherwise, yes, that's fine. I'll choose. Muscle pain. So muscle pain can look like a couple of different things. It can look like flower formulation sounds wonderful. Lex, hey. Okay. Yeah, we'll see. Muscle pain. We can have muscle pain due to spasticity, right? The muscles are tight, they're spastic, cramping, tightness. That's going to be the pattern of pain in muscles. If that is the pattern of muscle pain, then what we want is something to relax that spasticity, right? So what's going to relax the spasticity? Antispasmodic herbs are things like kava kava, valerian, cramp bark, lobelia, low-dose botanical, be careful with lobelia. So those would be helpful if that is the cause. Now, think about all of those, and here we have, again, almost all of those are sedating, right? And so, oh, and here's your this.
Here, do we put it in here?
You can just fill it in there. So this is a 15, this is 50 mils, and you're gonna go to 15 milliliters. So,
And then put it into here.
and then you're gonna fill it in there. So I will take one of the Sharpies and mark on the graduated cylinder where 15 mils is. It's easier to see. Otherwise, that's why it's always, they've all got the 30 mil marks, but do a 15 mil mark. And then just fill it with the tinctures up to your 15 mil mark, and then you can pour it straight into your 15 mil bottle. Back to you. What was I talking about? Muscles. Okay, so that's one type of muscle pain. If the muscle pain is spasticity, you could use those herbs, but you should also consider magnesium, because oftentimes when there's chronic spasticity of muscles, that can be indicative of a magnesium deficiency. Magnesium deficiency will cause muscles to go into spasm. It can be an indication of that. So, and that includes things like smooth muscles, the muscles that line vascular walls and bronchial walls and intestines and uteruses and bladders, right? Smooth muscle, cardiac muscle, right? So anytime you have spasticity or tightness of that, think of magnesium and think of that first, really, because nutritional deficiencies are something you always want to correct before going into nutrients, into herbs. But then also the antispasmodic herbs. You can also have inflammation in the muscles, right? And so that would be more a trauma response, right? So you've just tweaked the muscle, and now it's tweaked, it's damaged. You just injured it, and now it's in pain. That's where you could use something like the mimosa, and you could use frankincense. You could use burdock. That's when you have acute trauma, acute inflammation. You want to move those fluids out of there. You want to help to kind of quiet everything down, but also just time. Let's see, what other kinds of, those are the primary kinds of muscle pain that we would see in the different ways that would be addressed. Does that make sense? Does that answer your question? And are there any questions? Flower formulation, all the classes, la 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 la. Okay, well then we'll stick with flowers for formulation next week. All right, extreme workout. Yeah. Well, that's, it's funny that you should say that, JLP, because I worked out really hard this morning, and so I'm feeling like really good, but also really tweaky. And so I was like, oh, well, this is a perfect time for me to be teaching this class because I need to make a t-shirt for repair for my extreme workout. But that's okay because it felt really good. We had the Grand Prix. I live in Long Beach. I hate the Grand Prix. It's so horrible. And not only is it horrible, but it's held right by my gym. So all weekend long, I couldn't go to my gym because the stupid Grand Prix.
I can hear it in
was
Belmont
there.
Shore.
You can hear it
I went out to the beach
everywhere.
and I'm like, and it's like,
That low-grade wine, it's just, ooh, grates on our nerves. Yes. All right, I'm going to let you folks go, and I will see you next week. All right, thanks for showing up. See you soon. Bye.